And how did the ELCA get involved in trying to combat this illness?
Well, there's a long history, of course, of dealing with global health issues for the ELCA. The Evangelical Lutheran Church in America has mission personnel in a number of countries. A number of those places have the experience of malaria, the threat of it. So our own mission personnel certainly have experienced that over time, have somewhat experimented with medications, been on the front line of some of the medications, and I'm talking now from like the 50s forward as to what would be appropriate medical interventions for malaria. So there is quite a history, and obviously the observation, the awareness of the impact. So Lutheran Malaria Initiative comes really out of our own history and our own understandings of the difficulties that face our companion churches in Africa. But more specifically, this initiative was brought to us through our inter-Lutheran relationships with Lutheran World Relief and Lutheran Church Missouri Synod, when the United Nations Foundation approached Lutherans and said, could a partnership be formed that would help address malaria over the next, at that point, I think it was 2007, so until 2014 or 15. And that would coincide with Millennium Development Goals, which have a global health component to them that has a target date for 2015. So we really came into it in a way at that invitation of the United Nations Foundation, but also recognize awareness of and work with malaria over many years of global service.
Do you know, is it unusual for the United Nations Foundation to ask other groups to get involved in something like that?
Well, it is in one sense. I mean, we're faith-based groups, and that would be the category we would fall under from their perspective. And that's kind of a new arena for them. But the United Nations Foundation has quite a history of working and empowering groups to do specific goals or achieve specific goals, especially around Millennium Development Goals. So partnering and granting and that kind of thing isn't new to them, but the faith-based component would be that's a newer piece.
And how is it from the Lutheran end of things? How is it being structured? You mentioned that Lutheran World Relief is involved and that the Lutheran Church Missouri Synod is involved.
That's right.
How is it being coordinated with those three groups, and the ELCA?
Well, what we've done is we have a grant proposal process with the United Nations Foundation to secure these funds that UNF would like to have dedicated towards a campaign against malaria. So the LWR and the Missouri Synod worked together on the application, and the ELCA submitted an application, and that seemed like the wisest way for us to readily work together under a kind of larger umbrella called the Lutheran Malaria Initiative. The two and the one will each move in their own structures and their own patterns to accomplish this larger goal.
And with some coordination?
Yes. Yes, we've worked out, the logo and the case statement language, and certainly have financial goals that complement each other. So, yeah, there's been a good bit of that basic conversation and sharing. But going forward, it's not going to be all three of us in every setting.
Sure, where it makes more sense.
Yeah.
Is some of that information available on the website? Is there a special website for?
There is. You can, of course, go to the ELCA's website, elca.org/malaria, and find kind of the history of our involvement in it, moving forward to the present day and some resources there. There's also a website, lutheranmalaria.org, which was originally put together by the three and is particularly helpful in working with Nothing But Nets. Nothing But Nets is another UNF agency that works with providing insecticide-treated bed nets in places who need them in the world. So our partnership as LMI with them will do the same. And you can access that through the lutheranmalaria.org site in particular.